All content discussed on Hypochondriactor are the individual opinions of Dr. Priyanka Wali and Sean Hayes and should not be construed as personalized medical advice. I mean, come on, please. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical condition in either yourself or others. Please consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast.
My name is Dr. Priyanka Wali, and I'm a licensed and practicing physician, and I also happen to be a stand-up comedian.
Hi, I'm Sean Hayes, and despite my dazzling headshot, in which I wear a stethoscope, I'm not a doctor. And I'm still waiting for Shonda Rhimes to call me to play one on TV. But I am a brilliant actor. And as an actor, being a little crazy is part of the job. But for me, that's evolved into hypochondria. Every day I wake up, I swear to you, there's a new ailment that turns to a disease before I even brush my freaking teeth.
Each episode, Sean and I will talk about his medical fears and bring on an amazing guest with a fascinating medical story.
Oh, we'll also play games, quiz each other on medical history, and learn a few things.
All in an effort to do this thing called marry comedy and medicine.
And that kind of marriage is still legal, folks. I think it's safe to say that I'm not America's first hypochondriac, but I am America's first hypochondriactor. Priyanka, hello.
Hi, Sean.
You know, I want to start out by asking you something which I need to know and everybody else needs to know. I think it's kind of a little bit of a cliche that if you are of Indian heritage, that you come from a lineage of doctors. Is that true? Are there other doctors in your family? Do you know what I'm saying?
Oh, man.
Do you get that a lot?
That's a loaded question, though, because for real, almost every single person in my family is a doctor.
You're joking me.
No. If you look up the last name Wali under California medical license, literally every single person that comes up is related to me, except for like 2 people, and I plan on contacting them at some point to figure out what the deal
That's
is.
crazy. Wait, how many brothers and sisters?
Well, I only have 1 brother, but I'm talking about parents, aunts, uncles, their children, so bunches of cousins, all Wallies, all doctors.
Oh my God, that's so many free drugs within your family you could get.
They could do a documentary on us or something. I mean, it's wild. Yeah. In fact, I actually come from a long line of healers. Like my great-great-grandfather was one of the first anesthesiologists in Kashmir.
Come on.
Yeah.
Is that true?
Yeah.
Like, I've always wondered who created anesthesia? Like, how do you find that out? You're like, hey, come here. Can you try this?
My great-great-grandfather invented anesthesia. No, he didn't invent it, but he was one of the first, like, healers. In fact, I think our last name, Wali, I don't think we used to be Wallies, but because of this great-great-grandfather, Wali is actually like a Muslim last name, even though I'm not Muslim.
Mm-hmm.
And it means friend of Allah or something. But basically, our family lineage was renamed to Wali because this great-grandfather of mine was like helping so many people that they were like, you know what, this guy, we have to change his name.
That's amazing. We're going to have him on. Our guest today is the one, the only, the gorgeous and the sweet and the hilarious Kristen Bell. We're so lucky to have her on the show. She'll be sharing her experience with depression and anxiety, and I can relate.
And she's also going to be talking about this little thing called psilocybin, also known as magic mushrooms.
Oh, so it's kind of a magic show today, too. Is that what you're saying?
Something like that, yes.
But first, Priyanka, I know everyone listening is brand new to the show, but I always like to start off with a little kind of personal experience of mine or like a fear or like a medical story I have. So I feel like the whole reason I wanted to do this podcast, by the way, was so that I could maybe help others with my own stories, or at the very least, make them laugh, or at the very least, just get free medical care over the airwaves. So here's the deal. I have a fear of holding in pee, right? Like, not that you should. I have the opposite fear of holding it in too long. That's why I go to the bathroom more often.
Okay.
Well, I heard this one story a long time ago about a contest that a radio station was playing. And the contest was whoever could hold in their pee the longest while drinking water won an Xbox or some game console. I don't remember what it was. And a woman fucking died because she held her pee in too long. First of all, I think the radio station got sued. Second, you know, ever since I heard that story, I'm petrified of holding my pee in for fear of dying because, did I mention I'm a hypochondriac? I literally get out of bed 2 or 3 times during the night to pee because that story has stuck with me for 20 years. But most importantly, what happens to the body that would kill someone from holding in their pee? Like, what's going on?
Okay. So first of all, let's take a step back. Let's take a big step back and look at the facts. So I found that original article, and what happened is it was a radio contest. It was a water drinking contest, and they were giving participants a cup of water every 15 minutes, and people were dropping like flies, going to the bathroom, and then the ones that stuck around, they were giving them more and more water. This woman didn't die because she held her pee in too long. She died because she drank so much water, her sodium levels dropped. And low sodium, which is a condition called hyponatremia, it can kill you. It can basically cause seizures, brain swelling, coma, and eventually death. So that's why she died, Sean, not because she held in her pee.
Okay.
Yeah. So you can let go of that fear.
First of all, you just cured me of that fear. But second of all, wait a minute. So you can actually drink too much water?
It is a thing. It's very, very rare.
Because doctors always say, oh my God, you got to keep hydrated. And because of that, I'm constantly drinking water.
Absolutely. And that's fine. I mean, but this woman went above and beyond, your normal 8-ounce glasses of water, coconut water, or whatever you're sipping on right now. Yeah. There was a case in 2005 where a kid who was a college student at Cal State Chico died because he was getting hazed. He drank about 5 gallons of water in one sitting, and then he had a seizure and died. So that's the level. I mean, it's that amount of water.
Yeah, it's got to be like insane.
It's an insane amount. So if anything, you getting up 2 to 3 times in the night, I mean, there's other,
Yeah. There's other things to worry about.
You are released. Yeah. One fear down.
By the way, this is the truth. You really have just alleviated me, because I thought that woman died because of some kind of thing where you hold your pee in. Because if I'm driving and I'm like, oh my God, my bladder, I'm going to explode, I'll pull over to a restaurant because of that fucking story.
Well, okay, let me just allay your fears. You're talking about something that's called spontaneous rupture of the bladder. Okay, yeah. It's super rare, and most people that have that, they have some, underlying bladder issues, like maybe a cancer or something going on, and it's like literally 1 in 100,000. I mean, it can happen. Technically, anyone who doesn't pee for any reason can theoretically burst their bladder. It's very rare, but not in a situation like this. I mean, we're talking about someone that consumed tons and tons of water. So,
right.
you're doing good for yourself in terms of just go pee when you need to pee. Frankly, I mean, this is a great opportunity to bring up the fact that as a female, it's a lot harder to find bathrooms for myself. At least you can pee like on the grass or in your pool or whatever.
Just go in the men's room and pee in the urinal.
Oh, I do.
Okay. Priyanka, it's time to meet our guest today. Are you so excited?
I am.
Because she's a really, really close friend of mine. I love her so much. She is an actor, a singer, a producer, a philanthropist. She's well known for her roles in Veronica Mars, Frozen, and The Good Place. Last year, she co-founded with her husband a company called Hello Bello, a plant-based baby care product line, another one of those. And this year released a children's book that she wrote called The World Needs More Purple. I have my own copy sitting right here in my house. It's amazing. Please welcome the exhausting Kristen Bell.
Yay!
Thank you so much for having me, guys.
You're welcome. Thanks for coming here.
Yeah.
Okay, so in the show, we talk about, it's called Hypochondriactor because I'm a hypochondriac and an actor.
Right.
And everything's been wrong with me. And you were so kind to come on today and talk about depression and anxiety, which I also have, which Priyanka also suffers from. Yeah. So we're 3 peas in a pod. And if you don't mind me asking, Kristen Bell, like your first experience with depression and anxiety, how did you identify like what was going on? Like when did it hit you? You thought maybe something was off.
Mm-hmm. Well, let me press pause for a second on that long and exhausting question and just say, I also want to talk about eczema. Okay. That's a side note.
Oh,
file it in wherever you want to talk.
We can totally talk about eczema. If you actually only want to talk about eczema.
No, I want to talk about all of it. I will say, I don't think I'm a hypochondriactor because I actually am like, an optimist.
Yeah. You don't have to be. I think I'm the only one here that is.
No, but I know others.
Yeah.
I know others. I don't generally think things are wrong with me until I get very specific symptoms. But okay, so you asked a question about anxiety and depression, I guess when I was about 19. It was very young. And my mom, who experiences it as well, had said she's a nurse, and had said some really great grounding things about the topic in general. She said, look, I suffer from this. It's called a serotonin imbalance. I wish I could control it. I can't. I take a medication for it. And I just want you to know, if you start to have these feelings like apathy, or you want to lie in bed and you don't understand why, or you're having a lot of anxiety and your mind is spinning, you feel a lot of turbulence, or you just sort of, it manifests so differently for everyone. She was pretty broad, like just symptoms that don't feel like yourself.
Right. And I think people think that like the second they're sad, they must have depression. Like I'm depressed.
No.
Right. I think a lot of people think that.
It was very different for me that I just started to feel very not like myself. I was like irritable a lot. My, unfortunately, look out if I'm depressed or anxious, because I get irritable. And I know in my bones that's not who I am and who I want to be.
Yeah.
And so I started experiencing it, prior to leaving for college. She said, if you have any of these symptoms, there are so many options for you. She left a door open. She said, you can talk to a therapist, you can talk to a psychologist, you can talk to a psychiatrist, you can start exercising more and get on a regimen. You could possibly be prescribed a medication if that's what you need. But there's many, many things to help you. And she also said, make sure you never feel shame should you be prescribed something, because as a nurse, let me ask you a question. Would you ever tell a diabetic not to take their insulin?
Right, exactly.
And I was like,
I would.
I know you would, but most people would not.
No, right. I think it's kind of fun because Scotty, my husband, has diabetes. It's just kind of fun to hide the insulin, see what happens.
Yeah, it's like a weird foreplay for
and
them.
And remember, one time you did, because we were
know.
over one time, remember, when Scotty had a major
I know, that was
episode
crazy.
and literally
collapsed
to the ground.
Oh, you were there. Was that the thing that you told me about, Sean? Oh, interesting.
Yeah. Kristen was standing there and she's like, Scotty just fell on the ground. Is something wrong? It was so bizarre.
Guys, is Scotty? And then we were like, maybe, and he also hasn't talked for the last 10 minutes when we were upstairs. That was weird.
So, Kristen, it's really interesting. It's great that your mom's a nurse, because she had more than average, higher than average kind of knowledge about any sort of mental health issues. It's very interesting, because even amongst the healthcare system, there are things about depression that even healthcare providers don't know. Like, for example, the impact of nutrition on your mental health. For example, there's a lot of things that can cause depression-like symptoms, like iron deficiency, essential fatty acid deficiency, vitamin D deficiency. And a lot of times, healthcare providers don't know to screen for those things before offering someone a medication. So I'm curious if healthcare providers or your mom ever talked to you about your nutritional status before walking you down that route.
No, that was my own learning curve. When I was 18, it was a little bit more, that was 1944, and it was a little bit closer to the time in medicine where they said, well, if you're experiencing this, there's a pill for it. And what's your mom on? What was your grandma on?
Right.
Okay, well, chances are we're going to start there.
Right.
And we did, and it worked. But then it was only throughout my sort of like late 20s when I started reading about it and like actually, reading a little bit of popular science and looking at studies and stuff. And I, read things about how there's a possibility of getting off an antidepressant or an anti-anxiety because perhaps your sort of muscle memory takes over. I tried that. It worked for about a year. And then after a year, I got those symptoms again. And I was like, you know what? If I have to take a medication, I have to. But at that point, I was personally paying attention to I had a blood panel done and my levels are fine. I also eat nothing but rabbit food. I'm green vegetables all the time. I mean, drink olive oil. I was paying attention to that. But funny enough, no, that did not come from a healthcare provider. That was sort of my California food fusion experience that gave me that knowledge.
And what's weird is you sleep in a rabbit cage.
Yes.
Yeah.
I always have. From the time I was born.
Yeah.
My parents kept me in a cage.
Do you think that had anything to do with the depression happening? The cage?
I doubt it. Okay. What are you, a doctor? Come on.
So I'm curious, you've talked about medication therapy. What about alternative therapies like meditation? Have you ever worked with psychedelics for depression?
Oh, God. Are we going to have enough time to talk about eczema? I don't know, guys. Yeah. I'll give you a headliner. So I I don't even drink. I mean, the truth is I discovered wine last year and I'll twice a month have it, but I didn't drink for 20 years of my life from the time I turned 21. So I knew that I wasn't getting the things that were qualified as depressants in my system. And I knew I was paying attention to my nutrition. My husband and I went to TM classes, Transcendental Meditation, before the kids were born, and we loved it. And like, I believe in meditation so wholeheartedly. I would love to sit here and tell you that I do it twice a day, and that is incorrect. Yeah. That is not a fact. That's correct. Fake news. Okay. So I do it whenever I can, which I'm going to be honest, it's like once a month now because I have a 5 and a 7-year-old. But I do feel great when I do it. I rely on a lot of those techniques and like mindfulness techniques to really ground me.
I love that.
And then I read last year Michael Pollan's book, How to Change Your Mind. And I was slack-jawed. And I was like, wait a minute. Michael Pollan's book, the second to most recent one.
I'm writing this down. What's it called?
How to Change Your Mind. Buckle up, Sean. It's a 14-hour read, but...
14 hours? I don't have that kind of time. I'm depressed thinking about it.
It's a thick book, but do it on Audible.
Yeah.
So here's what it's about. He really goes into detail about this underground academic community that has continued to study the effects of LSD and psilocybin on what they call healthy normals. Back when sort of Timothy Leary ruined drugs and it became so scary because, everyone thought people were having sex in the streets. And like some of them were.
Sure they were.
But there are aspects to those two particular drugs that the places you can go in your brain are much sort of deeper and more healing than anything else.
Yeah.
It's not like alcohol.
Right.
And I was really interested in doing mushrooms. I really wanted to try some psilocybin and feel what kind of doors opened, have like a trip that was my own. And they talk about set and setting and how to make it comfortable. And I am very lucky to be married to an ex-drug addict. Not only did he know where to get the mushrooms,
but he got the good quality stuff, like the organic pharmaceutical grade psilocybin.
He got that really nice quality organic set and setting, beautiful mushroom. And then
Set it and forget it.
And then he babysat me.
Wow.
He was your sitter.
He was. I said it was for my birthday, like last year or something. And I said, I really would like to experience this. And I'm not going to party with it, but I want to know what this feels like. And I want to talk while I'm doing it. And I want you to talk to me. And he took me on a walk around the neighborhood. And it was so lovely.
Wow.
I mean, you read the book and you hear these people talk. And sometimes it feels like it's crazy because this woman I remember from the book was like, I'm not sure why my ex-boyfriend was yellow or in my shoulder, but he was there and he was yellow. And I'm like, what?
That's crazy.
I just remember I was so enamored with my own body.
Oh, wow.
I had gone to the bathroom, like I went to pee and I came downstairs like wide-eyed and I said, Dax, I had to pee. I felt the sensation of having to pee. And all of a sudden this beautiful lady, and I was pointing to my legs, picked me up. She walked me down the hallway. She sat me down on the toilet. She rolled a little roll of toilet paper for me and just put it on my lap till I was done peeing. Then she wiped me. Then she flushed the toilet. And now I'm back out here.
Newsflash, that was me. Yeah.
But like in my head, I had separated this body that had done so much good in my life, that has taken me through happiness and pain and workouts and laziness. And I was just like, couldn't stop touching my legs going, you're so strong. You're so elegant.
Wow.
Let me ask you about depression and anxiety. Like, by the way, how is it now? Is it better?
Yeah, I mean, it also comes in waves, but my waves are never suicidal or anything.
Right.
So I'm very lucky because that does happen to people. And by the way, I've heard that it can happen to not chronic people, but like you could just have a wave of it. You could have it for 3 months and it's because your brain isn't processing the right, chemicals.
So being an actress and a performer and stuff like that, or having to do like this, like a podcast, or having to be, quote, on, do you find that you have to go through some kind of process to, here we go, and I have to like become this thing? Some of that is depressing to me. Like, I don't want to be on right now. I don't want to be, and thank you for thinking that I am right now. But I don't, this is some of my best material. But you know what I mean? Like, talk me through that just a little bit, and then we'll talk about eczema.
Well, being on is a requirement because you have to understand that you have a very lucky position. And if you like the perks of this job, then you gotta, pay for the rest of it. And so sometimes that happens when like it's 5 a.m. and someone on set, a sweet PA, is really excited to see you and they want to talk. And you're like, first of all, no two human beings should be interacting at 5 a.m.
That's so true.
Okay, none.
So true.
Okay.
Exactly.
I don't want to talk to you right now, but you go, okay. I meet fans all the time. This is this person's possible only time to see me, and that's different.
Yep.
We're going through a different experience. I have to be respectful of that.
So case by case.
Case by case, but also I find that if I find myself getting irritable, then I know I need to slow down.
Yes.
Then I know I'm doing too much. So I have to stop making my Christmas list in my phone offset. Or like I have to put it down and just go, be here right now. Your feet are on the ground. You're
Right.
sitting in this chair. You see 7 people around you. You smell the tree next to you, whatever. Mine's also, I believe, like affected by stimulus. When I get too much stimulus, I get really irritable and it just spikes. But you just kind of have to know when to take breaks so that you're not overwhelmed. Because when I'm overwhelmed, my anxiety shoots up like skyrockets. But, I am still on a medication and I don't know if I'll ever be off it. I would love to think I would one day, but right now it's working.
Oh, we lost.
Did we lose her? Oh, there she is.
Oh, no. Oh, wait. Are you there? Are you
Yeah,
there?
Kristen, you were frozen for a second.
Sorry. We had to do it.
So Priyanka, eczema, isn't that like the skin thing where you're discolored, or is that the thing Michael Jackson had?
No. Michael Jackson had vitiligo.
Oh.
That's a totally different condition. Eczema, also known as atopic dermatitis, it's a chronic skin condition where you have very itchy, dry skin that's hyperreactive to certain stimuli like food or allergens or even stress.
Oh, wow. Kristen is now showing us her eczema on camera.
Oh, wow.
You see that?
It's like a touch
Wow.
red. How long have you had eczema for?
Well, I've had eczema since I was a baby.
Oh, okay.
My parents used to have to wash my clothes in like bar soap because detergent was so harsh. And I've gotten over most of those skin allergies. Like I'm totally fine with stuff, but I do really think it's stress because let me tell you something. I'm doing so much of loading up on like moisturizing it, using a steroid cream when I need to, like doubling up on my healthy fats. But this phase, which I am covered pretty much neck to toes.
Oh, so true inflammatory stress. Now, here's something interesting I want to ask you. Do you ever notice a correlation between your depression symptoms and the eczema? And the reason I ask, I'll explain this. Depression can also be an inflammatory disease where the inflammatory levels go very high and they cross the blood-brain barrier. And you can also have skin findings at the same time. So I'm curious if you've ever noticed anything like that.
My favorite band of all time is Blood-Brain Barrier. I have all their albums.
I would say, to be more specific, I've noticed it with my anxiety because I have a little bit of both. And the older I get, I feel like my anxiety is higher than my depression. And that's because of a desperation to multitask, to be a good mom for my kids and a career woman and all these things I feel I want. But I definitely notice a correlation between my anxiety when I'm on like hyper-focused, speedy, multitasking Kristen, and then my body looks like wrapping paper. I mean, it looks like a printed piece of wrapping paper of like just like red
Just a
and
gift.
skin colored.
I'd like to put a package in that.
And also, by the way, I'm a really good sharer. So if anybody needs some eczema, I'm happy to share some of this. You guys, I have more than enough.
So is there anything else that causes your eczema?
Stress. So when like the election stuff was happening, I had a huge bout of it and that lasted for 2 or 3 weeks. And it's really just me trying, listening to my body, paying attention in a mindful way. Okay, let's make sure I'm taking an extra probiotic and my extra vitamin C pill today, or also just making smart choices diet-wise.
I love that.
Of when to get especially some healthy fats when the eczema is flaring.
Great.
Has your dermatologist or healthcare provider ever talked to you about doing food allergy testing to see if there's specific allergens that are causing the eczema?
I did a whole profile on my back, where they pick you with a pin and stuff, and nothing. I was like the smallest amount allergic to pineapple and the smallest amount allergic to rose, and everything else was fine in my food profile.
Oh, wow. So then it truly is like a stress response from whatever stimuli you're being exposed to. You're clearly very sensitive to your environment.
I do think that's true. I know I'm an empath, and I often have a problem delineating between what your emotions are and what my emotions are.
Mm-hmm.
You know? Mm-hmm. So I definitely take on energy in the room. And if you decide we're going to be sad and grumpy today, I'm there for the ride. And I'll just go, like, I can't even control it. It's, I take on a lot of other people's anxiety because I sort of can't tell which is which emotionally.
Oh my God.
Right.
We are exactly the same person. I swear to God.
So a lot of performers and usually people in the healing arts, they tend to be empaths, which is what makes them so good at what they do. And this is the work of Judith Orloff, who wrote Empath's Survival Guide, which if you haven't read is a really good read. But she talks about the importance of creating really strict boundaries so you can differentiate your energy from the energy of others.
Oh, I love that.
She talks about this process of visualizing that you're like this golden orb and you're protected by this orb so that other people's energy doesn't affect you.
And it sounds so silly when you say it, but I feel it at such a true place in my heart that I'm like, I know how silly that sounds, but like I need it. Sometimes when I leave people that have had a weird energy on me, I physically go by my navel and I make a scissor sign, like rock, paper, scissors, and I cut the cord between them and I.
Yeah.
I do it in the air because I want to symbolize, like, you don't have to take any of that person's energy elsewhere. But yeah, that's really healthy. And I will say, like, with my husband being sober, I've done a lot of work in Al-Anon, and that is a very good, like, boundary, a way to learn boundaries and how not to enable, and also, you know, just distinguish you from the other person. And I like rescuing dogs because dogs are nature's antidepressants.
I love dogs.
Yeah.
Just speaking of cutting the cord, horrible segue. We're going to play a super fast game.
Oh, no. Okay. It's called Dr. Wali's Wall of Fame. Okay, so it's 2 rapid fire rounds. You're going to each get 5 questions. And if there's a tie, then I'm going to take into account the creativity of your answers. So the person with the most correct answers will be added to the Wali Wall of Fame.
Yeah, it's really fast and it's really fun.
Are you guys ready?
Oh, look at Kristen's so competitive.
Ready.
Now I'm getting eczema just thinking about it.
Sean's going to go first. He's going to have 5 questions, and then you, Kristen, will have the other 5, okay?
Okay.
All right. Sean, are you ready to begin?
Yeah.
Okay. Piloerection is the medical term for what? Piloerection.
Oh, well, come on. That's a pile of erections, also known as a dream come true.
Is that your final answer?
No. Are we supposed to not want whatever this is? It's something stiff. I don't know. I don't know.
Close.
Something stiff.
It's basically the medical term for goosebumps. Pilo meaning hair, erection standing on the end. So piloerection is the medical term for goosebumps. So
how about that?
Okay.
All right.
I
Well,
might give
one
you
wrong.
a half a point for creativity on that one, actually. Okay.
Okay.
Next one. True or false? Food dropped on the floor cannot be contaminated with bacteria if picked up within 5 seconds.
Oh, the 5-second rule? I would think that the germs have to decide if it's worth the journey to cross the entire room just to see if they like it. So yeah, I'm gonna say it's true because they don't have time to move.
Okay, it's
right?
false. The
shit.
bacteria will contaminate food instantaneously.
Are you serious?
Just immediately.
But not enough bacteria on the ground to get you
Well,
sick.
that wasn't the question, though, right? It was just if it's going to
it
get
is now.
contaminated. So, okay, the answer is false. Next question. Synchronous diaphragmatic flutter is the medical term for what bodily function?
Can you say it again?
Synchronous diaphragmatic flutter.
Okay, so synchronous is like sync, so something happened at the same time. Diaphragm, I heard that word, is in your stomach. Flutter is, I'm all aflutter, so it's, that. So it's something like, I don't know, like dry heaving or gagging or something?
Close. Kristen seemed very excited.
Are you serious? You know that?
Is it
a
hiccups?
hiccup. Yes, that's
You
the answer.
asshole.
Okay.
Wait, how do you know that?
Because I'm also a doctor, Sean.
Yeah, this stiff competition.
Jesus, God help us.
Okay, next question. What is the first step to providing CPR?
Well, a lot of people don't want to admit it, but you check their pockets for money. And then, while you're at it, you give them a Listerine breath strip just because they're old, probably, and they You have to make sure before you make out with them.
Thank you very
No, I
much.
think the first thing to do is turn their heads or something, right? In case stuff
You
comes out of
gotta
their mouth or something
first
like that.
check the scene, check the person, check their pulse. That's the first thing. Or I would have accepted call 911. I would have also accepted that answer.
So it's kind of
Okay.
close.
Okay, the last one. There's one bone in the body that is not attached to another bone. What is it called?
There's a bone that's not attached to another
Yeah,
bone.
there's one bone in the
your
human
knee.
body.
Is it your knee? Your kneecap.
No.
It's like floating.
It's your patella, Sean. It's the
Patella.
medical term is
My name's
patella.
Kristen.
It's not the patella. This is the only bone that is truly free floating. The patella isn't completely free floating.
What is it?
It's called the hyoid bone. It's in the throat, and it's not attached to any other bony structures, believe it or not.
Okay, so here's the thing I have to say. Kristen's about to answer her questions. If hers are even half as hard as mine, I win.
Okay.
I feel like I got all the hard
Yeah,
ones.
you did get, but in all fairness, like Kristen knew one of the really hard ones. So
I know. How in the world?
I'll give you a half point for piloerection, and then I'll give you a half point for stealing someone's money when they're dying.
Yeah, that was a good
1 point for
joke.
Sean. Okay, Kristen, your turn. Are you ready?
I think so.
A nephrologist is a doctor who specializes in the treatment and diagnosis of diseases affecting the... A nephrologist.
Nephrologist. Read the sentence one more time.
A nephrologist is a doctor who specializes in the treatment and diagnosis of diseases affecting...
The butt cheeks.
Very close. It's actually the kidney, which is a little bit higher than the butt cheeks.
A little bit, but close. And it's like nephrologist sounds like nefarious, and that's a scary
That's true.
area,
Yeah.
especially in my family.
So nephron is the medical term for kidney. Nephron. Yeah. Okay.
Oh.
True or false? Chicken soup can cure the common cold.
False.
Very good. That's false.
Oh. By the way, and angry about it.
Come on, false. Well, like first of all, I don't do fake news. I don't do myths. I do Eastern medicine when there's proved to
Absolutely.
be, but like that I believe comes from the old myth of like sitting down to have something warm, easy on your stomach with a fair amount of chicken fat in it. Like fats are
Yeah.
good for you. I believe that's where
Oh.
that
I love it.
comes
I
from.
love
Who
it.
are you?
Thank you,
So
Dr.
good.
Bell. I love it.
Yeah.
All right. Gustatory rhinitis is the medical term for what biological process? Gustatory rhinitis is the medical term for what biological process? Gustatory rhinitis.
By the way, she did get hard ones. These are hard.
Gusta, I want to feels like gastro, but I don't know if it's close enough, and I don't have a dictionary in front of me to check the spelling. Rhinitis. Rhine would be nose.
Gustatory is Gustatory. Gustatory.
Okay, see, that's not gastro. That's a trick. Rhinitis. Rhine is nose.
Okay.
Gustatory rhinitis is say the end of the sentence again.
Gustatory rhinitis is the medical term for what biological process?
Sneezing.
Ooh, super close. Okay,
Blowing your nose.
even closer. So
Viral droplets. COVID-19.
Bad nose job.
Gustatory rhinitis is the biological process of when you get a runny nose after eating spicy food. So gustatory is involved with taste, the gustatory process. Rhinitis is inflammation of the nasal passageways. So runny nose after ingesting spicy foods is gustatory rhinitis.
You just named a documentary that my husband has been compiling in his phone for over a decade. And it was previously titled Kristen's Obsession with Wasabi. And it will now be called Gustatory Rhinitis because I love, first of all, I think all my taste buds are dead. And I love wasabi so much that I will eat it with a spoon. And I love
Wow.
getting to that brink point where I'm like,
Yeah.
and everything burns and just like drips coming out of your nose. And he always tends to have his camera at the ready because whenever we eat wasabi, he knows I'll go for it and something stupid will happen. And now we can title the documentary.
Gustatory rhinitis.
Well, rabbits love wasabi.
Rabbits love wasabi.
All right. What is the first step for dealing with a minor skin burn?
A minor skin burn.
Yeah, a minor skin burn.
By the way, this was submitted by your children.
Go to your room is the first. Is it here?
If they're
Go to your room.
burning, go to your room.
But that's a trick question because that's what I do for very severe burns as well. I said, go to your room. I would say ice. If it's minor, meaning the skin has not broken open, then I would say a cold compress or ice.
Yeah, you want to run cold water under that area for like 10 minutes or until it's not as painful. So
like a cold
compress, yeah. But ideally, you would like to run cold water over the area for at least 10 minutes.
And even if the skin's not broken, because I do know I have numerous times had to call our physician because my husband doesn't like to go to the doctor, but he'll be like, I remember he was doing, I don't know, like gym jumps, I guess they're called, where you like jump up on top of something that's higher than you, like to your waist, and it's like a bodybuilder thing. I don't know, guys. But he did it and he killed his shin and it broke open very deep. I mean, very deep. Like there was white showing and I'm like, I don't know if this is the lowest layer of the skin or if this is bone. And he did not want to go to the doctor. So I called our pediatrician who I'm friends with. And I was like, hypothetically, if we had a real bad one here and we weren't coming in, what would we do? And she said, flushing is the absolute most important thing for any type of wound. She said he needs to be under the tap for a minimum of 5 to 10 minutes to flush everything out of that hole in his body, basically.
Yeah.
But I didn't know that it was also important when the skin isn't broken.
Mm-hmm.
Well, you're talking about wound care, which is, I mean, that is fine. Yeah, flushing is super important for that. But if it was just like a minor skin burn, then yeah, cold water, 10 minutes, call it good.
Yeah.
Yeah. Or until the pain subsides.
Give us a second, Sean. We're talking about wound care, just the doctors for a second.
I am raptured.
Okay, final question, final round. The movement of eyes during sleep is known as?
REM. No.
Yeah.
You're in REM.
Very good. Which stands for what?
Rapid eye movement.
Very good. Okay, so I think, 1, 2, 2.5 for the gustatory. I'll give you, I think we have a clear winner here for this round. Kristen, welcome to the Dr. Wali Wall of Fame.
By the way, I haven't won one.
Look, Sean, I told you, I tell you this every time. Like, by the time we're done, you're going to be a fellow doctor. So you have like higher standards.
All right, fine.
But we can take it to the producers.
Yeah, you have to review the
It just
tape.
takes a couple more co-hosting podcasts to become a doctor. That's how they're doing it these days.
Just 2 more. Kristen Bell, I love you. You're one of my best friends. Everything about you, I wish I was you. Thank you for being on here. I have so much love, respect, and honor for you for always being open about depression, anxiety, and now eczema.
Yeah.
So thank you for sharing everything.
I love you, Shawnee, so much. And Dr. Wali, it was so nice to meet you.
Likewise. And, I think it's so great to, from the patient perspective, to talk about something that clearly people aren't, comfortable sharing. I guess if there's anything you wish you could say to people out there that think they might be depressed but are too afraid to kind of come forward, what advice do you have for them?
Go to your room.
Go to your room.
Got it.
Well, for real, I would say be very careful trusting your own brain right now. Trust your body a little bit more and know that there is not one road in front of you. Because I have seen people halt any treatment for anxiety and depression or discomfort because they're like, I don't want to be on a pill. And I'm like, bitch, you don't even know if they're going to put you on a pill
That's
yet.
right.
You might not be a candidate.
Right.
So
Right.
I'm like, look, they might prescribe you an exercise routine. They might prescribe you just some talk therapy. You may just need to communicate better with your family and open up some more doors emotionally. Like, it is not a scarlet letter to wear.
Right.
And it's not the be-all, end-all just because you seek initial treatment. That's the door. And then, by the way, during your treatment, you'll learn a lot about what this disease is, and you may or may not decide a medication is right for you. But
Yeah.
there's a lot of different routes to feeling better, I
Yes.
guess is what I'd say. A lot.
Yeah.
Yeah. Thank you. Thank you. Thank you for that. That's super helpful. That's going to be very helpful to people. So thank you.
Thank you, Button.
It was a pleasure.
Guys, this was fun.
Wasn't
Thanks
it
for
fun?
having me.
Thank you for being here, honey.
Yeah.
Love you.
Bye. Love you too. Bye.
Bye.
Bye. That was such a wonderful episode. It was so nice to hear someone talk about something that people are usually so closeted about,
Yeah, kind of like me and you are open about it too, about our depression. And I think a lot of people think sometimes like depression is like an attention getter or like You know, especially if you're an actor. I suffer from depression. It's such a cliche to a lot of people, but it sucks when you really actually have it, or anxiety. Like I definitely have anxiety. A lot of people don't realize I was so lucky to find an avenue to express my anxiety, which was a role called Jack McFarland on Will and Grace. And that is true. I'm not even kidding. I've had so much anxiety my whole life. And that's why on the show, on the Will and Grace program, when I would come into a room or whatever, I'm super high energy and I talk really fast and blah, blah, blah. That's all anxiety. And I just got lucky that I got a job where I could use it to make people laugh and use it in the right role to make people laugh.
Yeah, totally. And my story's a little atypical because there's not a lot of physicians that perform stand-up comedy, but it's really using any kind of artistic medium as an outlet. And I remember when I was a resident, I was working 80 hours a week, seeing patients, and I was just like, I need to blow off some steam. Like, I need to let this out. And that's when I hit stage.
I always wonder that about doctors because all you hear are people's problems.
Yeah, and I think there's a lot of mental health illnesses in the medical community. Like, one doctor dies by suicide every day in the United States. It's a very serious condition. And so there's addiction rates are super high amongst physicians as well. And ironically, the specialty with the highest rate of suicide is psychiatry. So, yeah, we physicians definitely need outlets to let it all out. Stand-up comedy for sure, like, saved me. There's no question about it.
Well, laughter, it's so cliche and corny, but you know what I'm going to say.
I know I have a joke about it.
Dude, tell me.
Where I say to my dad, but Dad, they say laughter is supposed to be the best medicine. And he says, only people don't have health insurance say those kind of things.
That is so true. We're not laughing at people without health insurance. We're laughing at the joke. So, but Kristen Bell, thank God for her. Thank God for her being so open and honest and willing to always share herself with everybody, the audience in the world. And she's helped so many people come to grips with it and not feel ashamed about their depression. And she's a hero for that.
Yes, she's a wonderful empath.
Yeah, she is. Well, another fantastic show. I'm having the time of my life doing this. We want to thank our audience for listening and coming on this journey with us. I just love hearing all these stories. I feel like I've learned so much in such a short amount of time.
And if you like our show, please review us, rate us, and most importantly, subscribe on Apple Podcasts or wherever you listen.
Would you rate me, Priyanka? Could you do that right now?
Yes. In German, I'd give you a 9.
So that's a 9. I think that's a direct translation, no? Lord. Go to apple.co/hypo and subscribe now. Don't worry. Be healthy. Bye. Hypochondriactor is a Hazy Mills production, hosted by me, Sean Hayes, and Dr. Priyanka Wali. Michael Grant Terry and Todd Milliner are our executive producers. Rebecca Eisenberg is our producer. Production and editing is by Rabbit Grin Productions, and original music by Scott Eisenogel and Leor Rosner. This is a Hazy Mills production. All content discussed on Hypochondriactor are the individual opinions of Dr. Priyanka Wali and Sean Hayes and should not be construed as personalized medical advice. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical condition in either yourself or others. Please consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast.